So in dealing with shoulder pain, obviously one of the biggest buzzwords is a torn rotator cuff, right? Everybody's got a torn rotator cuff. Well, if you've watched our series on shoulder, and if you haven't, you should, especially if you have shoulder pain, because it's going to help figure this out, right? But rotator cuff is a major issue. There are 4 muscles of the rotator cuff. So you have your supraspinatus, your infraspinatus, your teres major and minor, and then your subscapularis. So these are the 4 muscles of the rotator cuff, or 5 really, but of the rotator cuff. But the biggest goal is here to make sure that these rotator cuff muscles, so shoulder, one of the biggest, probably the biggest issue short of like absolute just damage of like, like you just get your arm torn off or something like that. But most of the time in wear and tear injuries, especially the rotator cuff, these things can heal unless that rotator cuff is completely torn or almost completely torn. So if you imagine those muscles having all this, if you have a little tear here, maybe it's a couple fibers are torn, that rotator cuff is still viable. And many times most docs will not mess with that. You may even have multiple tears, and still docs may not mess with it depending upon age. Obviously, if you're here, that needs to be corrected, because then you don't have the action of that muscle. So if you can't move your shoulder in a specific direction, and not because of pain, but you physically cannot do it because there's basically no muscle to move it in that direction, obviously that's a huge problem, and it may even be too late. So I'm not telling you whether or not you want to or should have surgery, but when you have minor tears or pain in that rotator cuff, there are a lot of things that you can do to help get this better. All right, so a few of those are going to be, and we won't get through everything because there's a ton of soft tissue techniques, etc. But the biggest thing you need to make sure of is that those rotator cuff muscles do not have too much strain or stress on them. So as you sit in, and I've done videos on this before, but as you sit in space, you should be here. But a lot of people, as we age or we become developed, our shoulder starts to track forward. As that shoulder tracks forward, all those rotator cuff muscles that are through here are going to be strained. They're going to be pulled. And so you can imagine if I'm pulling that, then you may start to get so much stress and you're moving it through all these different ranges while it's being pulled. You may get that bing, 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 right? So you may start to get that tearing. And so one of the major long-term fixes of any type of shoulder pain is making sure the shoulder is tracking properly by doing rows, by doing external rotation, those type of exercises to help to build up that posterior strength, and then also too building down that lower lat of the shoulder and of the back, because that's not actually lat, I'm sorry, not your lat, but your trap, because that will help to pull that shoulder back. So you can imagine you either look like this or you're going to look like this, right? And so that shoulder wants to be here because that's the proper motion of that if you get it in that GH joint. And that will also, instead of those things being so pulled so tightly, they're going to be back more in their orientation. So you can get if it gets pulled for too long, it may not even be torn. You may have trigger points in those muscles. You just may have a lot of stress and strain, a rotator cuff strain. And so some things that you can do for that: one, soft tissue. Again, obviously you can get in there and do some myofascial release. You can do grasp and cupping, different things like that. You could do some acupuncture. You could do some adjusting. You could do different things in there that's going to help to get that shoulder back where it needs to get, to help to reduce that inflammation and get rid of some of those trigger points or some of that inflammation. But ultimately too, you have to get that shoulder back, right? You've got to get that stress off of those sits muscles, so that way they are where they need to be. They're not overly elongated, and they're not getting too much tension on them. Okay, so get that shoulder back. So when you have the anterior shoulder, again, we talked about this. This is probably more of that supraspinatus if it is rotator cuff. If it's real tender to touch and you can kind of track with your finger, you're like, oh man, that hurts out there too. I didn't really realize that. That's usually that supraspinatus. Now, if you get back here and you get real high above the scapular spine, so you can feel that scapular spine, if you're above that, that's going to be your supraspinatus. If you're below that, that's your infraspinatus. Both very important shoulder muscles. So if you're below that, you may have some trigger points in the posterior calf, so you'll feel that. And so that's the infraspinatus. You can get a lot of trigger points in that guy. Also in those teres major and minor, those can give you some serious trigger points. So we want to pull that shoulder back. We want to take the stress off there. We want to get rid of that inflammation, and we want to get that shoulder tracking properly again. Now this takes time, so be patient. This is a very mobile joint and a very difficult joint to treat. So take your time, get this done right, and then just keep with it, because the reason that a lot of therapy doesn't work is because you stop working it after you're better, or after the pain goes away. So continue to do what got you there and got you pain free and keeps you balanced and keeps you pain free. Continue to do that because it will continue to keep you pain free.